For the program of clean water and sanitation, we chose a program under Mercy Malaysia.
Assalamualaikum and a very good day to Madam Ani and my fellow friends. My name is Ainnazurah Binti Hairuddin and I would like to talk about the introduction to Sustainable Development Goals, more specifically water and sanitation. Sustainable Development Goals or SDG are an agenda introduced by United Nations General Assembly in 2015 and is set to achieve the target by 2030. These goals are a call to action from all countries, wealthy and poor, to increase prosperity while safeguarding the environment. They acknowledge that addressing poverty requires methods that promote economic growth and meeting a variety of social needs such as education, health, social protection and employment opportunities, as well as addressing climate change and environmental protection. Today, progress is being made in several areas, but generally, action to achieve the goals is not moving at the appropriate rate or scale. 2020 must usher in a decade of bold action to achieve the goals by 2030. With less than 10 years to achieve the Sustainable Development Goals, world leaders called for a decade of action and delivery for sustainable development at the SDG Summit in September 2019, pledging to mobilize financing, improve national implementation, and strengthen institutions in order to achieve the goals by 2030 without leaving anyone behind. The United Nations Secretary General urged all sectors of society to mobilize for a decade of action on 3 levels: globalization to secure greater light leadership, more resources and smarter solutions for the Sustainable Development Goals, local action to embed the necessary transitions in government policies, expenditures, universities and regulatory frameworks and people action, as well as by young generation, civil society, the media and private sector. Multiple social movement leaders and organizations have also called for a super year of activism to speed up progress on the Sustainable Development Goals, urging world leaders to intensify efforts to reach the world's poorest people, support local action and innovation, strengthen data systems and institutions, rebalance the human-nature relationship, and obtain more funding for environmental sustainability.
Hello, my name is Mohammed Rizal bin Roslan. Okay, now I want to present about description of the program, which is Project of Myanmar Emergency Floods Response that was implemented by Mercy Malaysia. Okay, first, the activity was conducted at 4 places in Myanmar, which is Kalay Township, Sagaing Region Yeki Township, Airawadi Region Emrauk Yo Township, and Rakhine State. The activity was implemented on August until October in 2015. Okay, for the number of attendees, it's more than 8,000, which is exactly 8,219 peoples. Okay, for sure, this project has their own goals to achieve, which is to make sure all the flood victims can get all the limited healthcare with a proper control. For example, Mercy Malaysia gave all the flood victims with a medicine kits and hygiene kits. In addition, among the project was work, all the stuff was prepared by Mercy Malaysia and they supplied to the place that was happened by the flood in Myanmar. So this is the method of implementation that was implemented by Mercy Malaysia.
Assalamualaikum, I am Nur Azaliya Aqila and I will continue to present about the description of the program. Lies a few pieces of equipment or supplies in the Mercy project in which they were involved. For instance, raw materials to construct a concrete school so that the children may learn effectively while the school is still flooded. In terms of cleanliness, it also creates a new environment. Mercy Malaysia also supplies sanitation facilities so that they could have clean water and maintain appropriate hygiene. Apart from that, in order to make sure everything went well, Mercy Malaysia has a medical team to the place where the flood happened. On the 4th of September 2015, a medical expedition was dispatched to the Airawadi area which confronts a food crisis every year. Mercy Malaysia and Myanmar Pediatric Society collaborate, which provide medical services to 448 patients in Queen Yor village, which has a population of 583 people, including 3,593 population. A team of 1 medical doctor, 1 team's assistant and 1 nurse was dispatched to Mohd Township in Rakhine State to support the Rakhine State Health Department during the emergency response. During that time, the medical team saw a total of 2,431 patients, with 1,293 of them being female. As fact, 2 members of the Mercy Malaysia Country Office were sent to assist with the reaction. Across its emergency efforts in Mohd Township, the team was able to deliver 500 sets of medical mosquito nets. The State Health Department tasked Mercy Malaysia's Country Office with coordinating food response activities in Rakhine from Yangon, where a contribution of 1,000 water purification sachets was successfully dispatched from Yangon to Rakhine.
Greetings everyone. My name is Mohamed Nafiz bin Mohammed Khaldun with matrix number 2019280262, and today I'm going to talk about the benefits, contribution, impact of the program to sustainable development clean water. The main benefits of the clean water and sanitation program is to avoid a disease. Having access to clean water and sanitation eliminates the risk of contracting a variety of ailments. We're moving to the second part. It is to provide all people with a safe and reliable water supply, as well as effective water sanitation. And the next is, Malaysia clearly recognized this program need to achieve those rights. The situation regarding access to drinking water and sanitation for everyone, with an emphasis on leaving no one behind, would be very different. And lastly, to reduce population illness. Concerned about this issue, the United Nations adopted SDG 6 to provide appropriate sanitation and water services to all people by 2030. To sum up, many countries lack the necessary infield data collection system to collect even the most basic information on climate, river flows and water quality. Monitoring resources implications were also underlined, both in terms of staff schedule and budgets, as well as through improved cooperation between ministries and agencies. The United recommend an integrated approach to data collecting to save time and money by leveraging synergies and avoiding overlaps in monitoring operation as part of the 2030 agenda.
Hi, I'm Zubairi Aizat, and I'm going to talk about program recommendation. Water sanitation and hygiene, or WASH, is an umbrella term for all activities aimed at improving people's access to clean water and sanitation, particularly for the millions of people in the developing world who do not have it. Safe and sufficient WASH is critical in the prevention of many NTDs, including trachoma, soil-transmitted helminths, and other diseases. Evidence suggests that increasing service level for safely managed drinking water or sanitation, such as regulated pipe water, sewer connection with wastewater treatment, can drastically enhance health by lowering diarrheal disease fatalities. Water safety, sanitation and hygiene are critical to human health and well-being. Safe WASH is not only prerequisite for good health, it also contributes to livelihood, school attendance and dignity, and it aids in the development of resilient communities that live in healthy environment. Access to potable water is one of the most effective tools for boosting health and alleviating poverty. The advantages of improved sanitation go well beyond lowering the risk of diarrhea. This includes limiting the spread of intestinal worm, schistosomiasis, and other diseases, all of which are neglected tropical diseases that affect millions of people. Second, we must lessen the intensity and impact of malnutrition. Third, fostering dignity and increasing safety, especially among women and girls. Fourth, promoting school attendance, the provision of separate sanitary facilities, and the potential recovery of water, renewable energy, and nutrients from fecal waste boosts girls' school attendance. Improving global wash access knowledge is an essential component of overall health and care effort. It provides quality sanitation and hygiene service to approximately 100 million people. Wash work entails both a hardware and software approach, with the hardware side constructing wash infrastructure such as toilet and community water pumps. In addition, sewage system, water storage, and water treatment facilities must be repaired or built. On the software side, it conducts hygiene promotion and behavior modification initiatives to increase people's understanding of excellent sanitation and hygiene behaviors such as proper hand washing, assist communities in managing and maintaining their water. Sanitation and hygiene facilities. WASH initiatives are increasingly being integrated into other areas of long-term and emergency work, ranging from nutrition to protection, gender and inclusion.
In a nutshell, people nowadays are living better lives throughout the world than only a decade ago. More individuals than ever before have access to improved healthcare, respectable jobs and education. However, inequities and climate change are threatening to undermine their advantages. In this context, there are still people that are living without clean water and sanitation available for them when they have all the rights to have access to clean water regardless of their location, social status, and etc. Moreover, even though the world's needs today has changed, the need for clean water still has not changed one bit. In order to reach the 17 Goals of Sustainable Development by 2030 as agreed in the meeting, every party, be it world leaders, social movement leaders, and etc., should work closely together to save the environment as soon as possible before the damages become irreversible. After all, we only have one beautiful planet Earth and we must protect and preserve it at all costs.